Before cancer, the only pill that I took daily was vitamin D for low levels that were found in normal routine blood work at my annual physical. And if I went away for the weekend and didn't take my pills with me, it was no big deal. After cancer treatment ended, things changed drastically. Now I'm 40-something years old and have a well laid out schedule of when I take everything to make sure none of my medications interfere with each other. Welcome to Life as a Cancer Survivor. My name is Jelena, and I was diagnosed with stage 3 rectal cancer back in 2016 at the age of 34. For my treatment, I went through 28 days of radiation and the oral chemotherapy Xeloda. Then I had a lower anterior resection, also known as LAR surgery, where they removed 12 inches of my colon and rectum, they took out 17 lymph nodes, and they created an ileostomy to allow the resected site of my colon and rectum to heal. Since the tumor in my rectum was still visible and there was cancer still present in a couple lymph nodes, I then did 8 rounds of the IV chemotherapy FOLFOX, and 2 months after I finished that, I had my ileostomy reversed. Now that you have a better idea of the treatment plan that I went through, follow me through my day as I explain all the medications that I take. Starting first thing in the morning, I take 2 teaspoons of Metamucil with about 4 ounces of water. Having an ileostomy for over 7 months, having 12 inches of my colon and rectum removed, plus the radiation and the oral chemotherapy that I did, all have made it so that my body can no longer form normal-looking stools. I take the Metamucil with just a small amount of water so that it can bulk up my stools and make them look more like a sausage instead of like fluff. For the next hour, I avoid drinking anything so that the Metamucil can do its job and bulk up my stools without getting watered down. Also, according to the instructions on the side of the can, you're not supposed to take any medications 2 hours before or 2 hours after because it can interfere with the efficacy of any of those medications. So that's why I take it first thing in the morning, and then I don't take anything else until a few hours later at lunchtime. At lunchtime, or rather after I eat, I take vitamin D, B12, and calcium. I take calcium because once I finished treatment, I went in for a bone scan based on a recommendation from my general doctor. In that scan, it was discovered that I have osteopenia, which is the beginning of bone loss, but it hasn't quite turned into osteoporosis. Taking calcium is one of the steps that I'm taking to try to limit the amount of bone loss that I have and even try to regain some of the density. The vitamin D is unrelated to my cancer diagnosis, but taking vitamin D at the same time as calcium helps the calcium be absorbed into the body better. The vitamin B12 is also unrelated. My doctor recommended that I take it daily because I'm a vegetarian. An hour after I take those vitamins, I take cholestyramine. At least I think that's how you pronounce it. I'm probably going to pronounce it different every time that I say it. But I take 2 scoopfuls of that powder with a glass of water. My doctor added this to my medication list recently in an effort to reduce my reliance on taking antidiarrheal medications daily. Cholestyramine isn't specifically an antidiarrheal medication. It is a bile acid sequestrant and is also used to lower cholesterol. My doctor was curious if my shortened colon was causing more bile to be in my colon, which would cause diarrhea. My cholesterol is a little on the high side of normal, so lowering that isn't a bad thing for me either. She preferred I take the powdered version because with my shortened colon, she thought that the powder would be absorbed better than pills. If I forget to take it within an hour-ish after lunch, I have to make sure that I take it at least 4 hours before I take my bedtime medications because the powder can affect the efficacy of fat-soluble medications. That also means if I get a headache in the middle of the day and it's bad enough that I need to take some ibuprofen for the pain, I take the risk of it being not as effective if I take it within 4 hours of this powder. Now we move on to bedtime, the last of my daily medications. Because my treatment put me in menopause, and it's not healthy to be in menopause in your mid-30s, I was put on hormone replacement therapy. My cancer wasn't a hormone-sensitive one, and I did genetic testing, and I don't have any of the genes for any of the hormone-sensitive cancers, so I discussed with my doctor the risks and benefits, and we decided that the benefits outweighed the risk to taking hormone replacement therapy, also known as HRT. I take separate estrogen and progesterone pills, so the dosage of each could be adjusted independently of the other. Being on HRT has helped with reducing my menopausal symptoms, specifically hot flashes. Since I went into menopause before the age of 40, taking HRT can reduce my risk of heart disease, stroke, dementia, and osteoporosis. As I mentioned earlier, I do have osteopenia, so I have lost some bone density, most likely as a result from the radiation and multiple chemotherapies I went through, but it could be worse if I wasn't on HRT. In addition to the medications I take daily, I always have on hand the antidiarrheal medication loperamide, also known as Imodium, on hand just in case I'm having a bad bathroom day and need a break from the toilet. With the addition of the cholestyramine to my daily medications, although it does have some more restrictions as to when I can take it around other medications, it has helped to wean me off of taking loperamide daily, which was the goal of it. I've gone more than a week, multiple times, without having to take a loperamide, which is huge for me. Going from only having to take one medication a day to the long list of medications that I just went through has been an adjustment. Remembering to take everything at the right time daily is difficult, especially since I don't have the same routine every day. Remembering to take everything when I'm away from home and traveling, that's even harder. Gathering all the medications that I need for a trip or even just a weekend away makes me feel like an old person. My life will never be the same as it was before cancer. So I just have to accept and deal with the fact that this is my new normal. One day, when I'm within the normal age range of being in menopause, I get to drop taking the progesterone and estrogen. So that's 2 less pills that I have to take daily. But that's still quite a few years down the road. Want to hear more about the roller coaster of life after finishing cancer treatment? Check out the playlist up here. Or check out this video down here that YouTube thinks you'd like from my channel. And thank you so much for watching.